Welcome, everybody. I'm Eric Westrich with Aquilius, and we're here with Irit Rappley, who's the Chief Scientific Officer at Telomics. And the reason we're so excited about having Irit here is because we've got the Mental Health and Brain Technology Symposium coming up. So we're going to learn a lot about neuroscience and what Irit's passionate about, how she got there. Irit, welcome.
Thank you. It's great to be here.
So obviously you've got a lot of neuroscience background from heavy duty, top of the stack academic institutions, a lot of lab work, a lot of science work, chief scientific officer, directors, things like that. So this neuroscience thing, was this something that was early on, or was there one moment, something in your life that really said, wow, this is important and I want to be part of that? Take us back to the first time you really realized that neuroscience was something you definitely wanted to be a part of.
Yeah, it wasn't my dream growing up. I actually always throughout school thought I would study math and computer science. Um, and I really loved computers because it was like a language, and I love languages. But actually, I took a long time off from between high school and college. And one of the things I did was I worked in a venture capital company, and I was the first point of triage of all the incoming business plans. And this is right, like out of high school, not with a degree or anything.
How did a high schooler match up with a venture? How did a math and computer from high school match up with a venture capital? Is that
That
something?
is that is a whole different, very long story that is not directly relevant to how I got into neuroscience. But
Well, answer this question. Did they find you or did you find them?
I found them.
Very good. Okay.
And so as part of my role, triaging business plans, I would just read about all the cool ideas people had of kind of what was up and coming, what was next. And it served as a really great opportunity to think about what would I want to do? What could I envision myself doing? And I found myself gravitating towards all the business plans that talked about the brain. And over the time that I worked there, it kind of occurred to me that the only thing I could really envision myself being interested in doing for decades, for a career that spans decades, would be to investigate the brain. Everything else sounded interesting, but I felt like I'd get bored after a little while. And that's when I knew that I wanted to study the brain. And so when I was ready to go back to school and earn my bachelor's degree, I applied to MIT for brain and cognitive sciences.
Okay. So obviously neuroscience is a very large field and there's lots about the brain that we still don't know, different paths of exploring it. How did you get on the path you're at? What was it specifically about the brain that you ended up getting most interested in?
That was a further path of discovery. So while I was doing my undergraduate work, I started to think about, okay, like here I am studying the brain. What am I going to do with this? What does a career studying the brain look like? And I realized, I kind of thought about what I wanted to do, what I wanted to be able to say I've done when I look back, from, the ripe old age of retirement, when I look back at my career, what do I want to say that I've done? And what's really most important to me is helping people. And so that kind of crystallized for me that what I wanted to study was diseases of the brain. And after thinking about what kinds of diseases, I mean, there are lots of different types of diseases of the brain, right? Epilepsy, developmental diseases, psychiatric diseases, language related diseases, which is what I initially was targeting given my love of languages. I realized that I thought the biggest unmet need, the most suffering that needs to be alleviated in the world really is around the neurodegenerative diseases, Alzheimer's disease, Parkinson's disease, ALS. These are devastating diseases that completely obliterate lives, not just patient lives, but caregivers' lives and families' lives. And many of these, Alzheimer's and Parkinson's in particular, are extremely common, right? We all have someone we know or are related to who is suffering from or has suffered from one of these diseases. That seemed like such a tremendous area that requires study and requires solutions, and I wanted to be part of those solutions.
So as you started connecting with people, getting close, did you end up having to work with people directly of this, or do you spend more time studying about that first and then connecting with people?
Well, I also know people directly, have people in my family who have these diseases. My mother had Parkinson's disease, other members of my family as well, Alzheimer's disease, of course, as well. So it didn't, it's not like trying to work on a rare disease where you have to make a special effort to meet patients. We all know patients with these diseases in our lives, myself included. Um, I think that um, for me, the path was the path of discovery and kind of honing my focus was really more about in what way do I want to make an impact in this area. I started out in my undergraduate research trying to understand why people get sick by studying patients and looking at studying memory in Alzheimer's disease patients and early Alzheimer's disease, and how is that different from memory in function in healthy controls. And the frustrating thing was that in spite of the fact that we were doing really cutting edge research, we were never going to be able to answer the question of why did this person get Alzheimer's disease? Because by the time we saw the person, they already had it. And the questions we were asking were not going to be able to understand what happened 10 years ago or 20 years before. So for my graduate work, I decided to go into molecular and cellular neurobiology, which is the study of the cells themselves and how they function, in order to understand why are brain cells dying in Alzheimer's disease or in Parkinson's disease or in ALS. And it turned out that the answer was because of stuff happening inside the cells, proteins aggregating, forming plaques and tangles and things like that. And that we weren't going to be able to answer the question of why do those proteins do that by looking at the cells from the outside. It was the same problem I had studying people from the outside, but now just on a smaller level. So for my postdoc, I did actually go and study the proteins themselves and why they're aggregating. And I don't know exactly, and no one knows exactly why it is that this particular protein in this particular cell forms clumps that don't happen in a different cell in that same person's brain or in the brain of another person who has the same proteins in their brain. There's still a lot to be learned, as you said, but through that training, all the way from the beginning of my undergraduate through my PhD and then to my postdoc, I had got kind of a perspective of the whole thing, right? From the smallest proteins and why they aggregate all the way through the cells to the brain, to animals, to people. And then I was able to say, what I really want to do is take all of that training, take all of that insight, and apply it to creating new medicines to help people who have these diseases.
Okay, on your journey from person to student to expert, there's a lot of things you have to learn. You still have to learn computers, can't get away with that. But now you have to learn the bio proteins, even down to atomic level, oh, so many things. Was there what particular thing was either the scariest for you to overcome or learn, or the hardest? You know, if you think of your biggest or scariest challenge in getting those skill sets for your personal journey, what was that?
That's a good question. I don't know if any of them were really scary because I love to learn. It's one of the reasons I'm in the field that I am. It's one of the reasons that I wanted, that I gravitated towards the one field where I thought there were going to be open questions and learning opportunities for the foreseeable future for decades to come. That's why it's important and interesting to me. So I can't say that any of them have been scary necessarily, but probably the biggest challenge, the biggest risk, or the one that made me like the stop and think the most was starting my PhD, because that is a like 5 to 7 year commitment. And you really have to be sure that it's what you want, because it's a lot of work. And I didn't know this going in, but I tell every student, everybody who asks me, I tell them this up front. You go through a period of 3 to 5 years in the middle where nothing seems to work and you feel terrible. and it feels like you should quit, but you shouldn't. It's part of the learning process, and you wouldn't be able to do the work if you didn't go through that dark time. I went through it too. And so I think that, like, standing on the precipice of such a large commitment, and at the time it was the longest commitment I'd ever made to anything, that was probably the single biggest decision.
I am going through just coming out of that dark time right now. So,
It's, I mean, you have to go through it, and that's when we learn the most, is when we're troubleshooting, when things aren't working. If things just work all the time, you end up not really learning. Um, and I remind myself every time that I go through things that don't work, that this is when I'm learning and it's
and
important.
it's just it seems like a big mess. There's all this stuff,
Yeah.
and at some point it starts going, oh, there's a connection here. And
But
that's
you have to go through the mess in order to see the connections,
but
right?
it's not, but if you're doing that level of work you're doing, it's not clear. It's not like you open up, see the mess and go, oh, of course. It's
Right.
just
No, that's why it's a challenge, but that's why it's fun.
it definitely is. And it's definitely fun once the thing makes sense. You go, oh, I can do something now. Now that I know that these things are related, I know we could do something or find out more. So that's um, a good point. So talk about your job as Chief Scientific Officer at Teal Ormic. So that's a business side of things as opposed to academic. How did you find yourself in business with the organization you're in?
Well, it's all a journey, right? This is the latest step in a journey. I started out as a bench scientist in a drug discovery organization at Celgene, and I learned how to think about drug discovery. I learned what is the process of drug discovery? What does it mean to run a screen for molecules? What does it mean to have a first molecule and try to see if it can become a clinical candidate and potentially be used in people? What are the questions you have to address? Um, then I learned how to apply that to neuroscience. I learned how to build organizations, build teams, build strategy in neuroscience in particular. And all of those learnings together kind of have brought me to where I'm at today in Teal, where we are building an organization that is applying learnings from our platform, which is taking information from blood proteins in particular, and using them to understand about the function of every organ in the body, creating fingerprints or signatures for every organ in the body based on circulating proteins in blood, and then turning those signatures into insights about the function or dysfunction of organs in health, aging, and disease. And my role as Chief Scientific Officer is to help guide the science and the strategy of this work, of this organization, and to help decide what we're going to do, how we're going to do it, what programs we're going to embark on, what collaborations we can come up with, right? Who we can work with, and how we can advance the field, both of science and proteomics, but also aging and disease.
So you're kind of a journey from knowledge and people to action and reaction and outcomes to putting together a team and making them functional to do something about it, which is kind of where the business arm comes from, as a journey to say, well, now that I've spent all this time going through those dark times you talked about, how do we do something about it? You can't do that without a good team, and a good team can't do it without good science, at least for that, what you're doing. So in taking that in your day-to-day job as chief scientific officer, um, what do you like best? What is the one thing that if I took away from you and you said, and I said you cannot do that anymore, we're going to give that to somebody else, you would be most disappointed. What is it you love to do about your day-to-day job as chief scientific officer at Teal Ormix?
Ooh, that's a hard one because there are a lot of aspects that I really
If
love.
I get to pick one though, just so we get an insight,
Well,
just
it
talk
would,
about one thing you love to do as part of your job.
yeah, it would probably be working with a team. So I think that if you told me that I had to think about the science and the strategy and the business and do all of that stuff, but in isolation, although I am an introvert, I would love my job less. I really love working with the team. I love building the team. I love the interactions and the brainstorming that come from having a wonderful team. I think we all synergize, and as a team, we do more than we could have done as individuals, each sitting in a separate room, even if we were all working on the same project, right? It's the interactions, the coming together. There's something really special in that, and I really love it.
And if there's one thing I could take away from your daily job that you would no longer ever have to do again, what would that one thing that you would like me to take away?
Ooh. Um, I don't think there's anything I do that I wouldn't want to do at all. I think everything that is part of what I do, whether it's grant writing, fundraising, collaborations, team building, team kind of management, obviously the scientific aspect we haven't even talked about in detail, all of it contributes to being able to do my job well. There are probably aspects I would love to do a little bit less of because they're very time consuming and I feel that they
What would
take.
one of those be? What would one of those things be? Give us some insight into one of those tedious parts of your job that's important.
Yeah. That would probably be grant writing. I actually really love to write grants, but one at a time. Like I don't want to do four or five at a time. Then it becomes really, really difficult. But writing grants in particular does force me and force us as scientists to be really thoughtful about what we want to do and why does it make sense and how are we going to do it and how will we know if it works and what will we do if it doesn't work. These are all really important questions. It's why I do enjoy doing the grant writing, but they're very time consuming. And so when there's a lot of it that you have to do at the same time as a lot of other things, it becomes difficult to juggle.
Okay. Give us an insight into what a really successful conclusion or event looks like for you. You can think back to something you've done in the near future, or in the near within not too far, something that you've either done, are doing, or could do that makes you feel like you made the absolute right choice in your profession and where you are to say, this is why I'm here. Is it something, is it a grant you won? Is it a customer you made happy? Is it something, if you could take us into something that really lit up your insides and made your spirit soar, give us a specific example of something that has happened or is happening for you.
For me personally,
Yes, you personally.
it would be having medication that helps patients.
Can you give
Um,
us a specific example of a medication that's helped?
So I haven't yet contributed to a medication that's gone on the market. That is something that is actually a very rare occurrence. The vast majority, more than 90% of experimental medications, compounds, molecules that might someday become drugs fail. So the vast majority of people who work in drug discovery never work on something that becomes a marketed drug. And I'm one of those vast majority of people. I haven't yet. But for me, I have worked on several programs that developed molecules that have gone into clinical trials. And going into that first in human trial, the very first time that that something that you've touched is being tested in humans is already a huge win and a tremendous feeling of accomplishment. Now, for several of those, three of those, I think that I've personally touched and worked on are now going through clinical trials, and we're waiting a decade in some cases to know if they really work and can go to market, can become actual drugs that will help patients. No one's holding their breath. It's a really long process,
But
but
even getting to clinical trial is a big win for you.
it is.
That's like, so that's like the Super Bowl cheering. You're in that, you made it. Then you have to see whether you win the game, which is an awful long game,
So
but
getting to clinical trials is probably like going to the Super Bowl or going to the playoffs or, in whatever sport
yeah.
you say. It's already a huge accomplishment and not a lot of people do it. But the real win, like winning the Super Bowl or the Stanley Cup or the World Series or the whatever it is, that's like getting a drug to market. And that's something I'm still aspiring to.
So, with everything happening and all the possibilities that could happen in 1 to 10 years for you, is there one thing that you're most excited about right now when you think about it? You say, this is really exciting. This is what focuses your energy when you think about great things that could happen. Can you give us a specific example of something that means a lot to you about the future?
There are so many possibilities. There are so many different ways that
Give us one thing you think may happen. A drug may get approved, a knowledge may happen, something may happen to your company. Kind of give us insight so we could see specifically what you think may be a big win for you, your company, or all of us in the next 1 to 10 years.
ooh. All right. In the next 5 to 10 years, probably not 1 to 5, but in the next 5 to 10 years, I think a huge win for all of us would be the advancement into or the potential success of new medicines for Parkinson's disease and Alzheimer's disease that are going beyond the available kind of what we know today or the drugs today. So in Alzheimer's disease, for example, there are now two approved and marketed new drugs that are supposed to be disease modifying. They have very modest effects, but it's not nothing, right? I think within 10 years, we're going to see much better options for patients, things that are much more helpful and that really slow down the disease progression in a meaningful way for patients. Similarly, in Parkinson's disease, in the next 10 years, I think we'll get there, and that will be a huge win for tens of millions of people.
Well, my wife, who does elder care, will be very excited to hear that because obviously dementia and Alzheimer's is a big part of her daily life. And I know it is for them. The people have it and they're caretakers, but the whole family, it's a very wide-ranging impact. So that is very.
Absolutely.
Is there anything we haven't talked about that you think everybody should know about you, teal omics, or neuroscience?
No, we've covered quite a bit.
Well, very good. And of course, if the most important question, if somebody wants to learn more about you personally, Irit or Teal Omics, what's the best place, absolute best place for them to learn more?
Yeah, so we're going to be at the Aquilius event next week, and so finding me in person there would be
That's the
fantastic.
best. That's the best
That's
place. That's why we're doing
right.
videos, so people can say, I want to meet that person in person, and you can.
Exactly. But if you can't make it to that meeting, or if for whatever reason we miss each other, then people can reach me personally on LinkedIn always. Teal Omics, we have a website, tealomics.com, and
Now
people can
let's spell it for people. TEALOMICS.com.
exactly, thank you. And they can reach us there. Or they can again reach out to us on LinkedIn or reach out to me on LinkedIn and tell me that you're interested in Teal Omics. Those are probably the easiest ways to connect people here.
And for those out there, if you like conversations about getting fully funded, fully resourced, and fully connected with knowledge, mentors, um, resources and other networking, Quilius.com is a great place to start, as is Quilius on LinkedIn, Instagram, and other things. Links in the bottom. But yeah, I look forward to the symposiums because there's just no better conversations in all kinds of areas. I've never been to one of the Quilius symposiums where you didn't have a conversation that you walked away with that was definitely startling and worth the time. So look forward to everyone uh, being there, and you'll get to hear Irit and others with some great speaking. We'll take a break. You get to hear some great companies pitch, and then my favorite part is, of course, the networking after. So everybody, Irit, thanks for being here, and everybody, thanks for watching.
Thank you so much, and I look forward to seeing you next week.